in 2011, I was diagnosed with HIV. Then I had just completed my studies as a professional nurse, and I started developing an interest in HIV because I was now personally living with HIV. And it started in the workplace where I changed my working environment. I went into HIV case management, which basically included managing patients telephonically, so to speak, advising their doctors on how to manage them. And I would also monitor their progress whilst on treatment. And then after that, I went on to be a nurse mentor. And after that, in 2014, I then came out publicly about my HIV status and went on to a television show that was then hosted by Griselda Kananda. And then after that, a lot of people started reaching out to me, which actually made me realize that, a lot of people need help. A lot of people need people that have actually walked their path. And that's where the activism started. I started reaching out to people, advising them on what to do and how to basically go through this journey of living with HIV. And early this year, I established a group with two other ladies called the Dynamic Trio. And we are basically an online counseling platform. And we predominantly deal with issues of HIV, domestic violence, and sexual assault. Initially, when I was diagnosed, I'm not going to lie and say it was easy. It was not. It was difficult. At some point, I was depressed. At some point, I had suicidal ideation. I wanted to kill myself. So it wasn't easy back then. And I remember socially, I used to be very paranoid. I'd walk into a place, and when people would look at me, I wouldn't think, oh, I'm a gorgeous lady. They're probably looking at my beauty. Or I'm tall, they're probably looking at my height. Or I've got a gorgeous hairstyle, they're probably looking at my hairstyle. I'd automatically think that they know about my status, and therefore at that point I started being withdrawn socially. So it affected me mentally, socially, and I'd say financially, because after that, shortly after that, I was at work. I committed an act of negligence because I was very stressed. It was shortly after I was diagnosed, and as a result of that, I was then suspended from work for a period of, I think, 3 months without a salary. So my HIV diagnosis in the beginning actually affected me very much. Yeah, but then time went on. I started therapy. I saw a very great psychologist, and she made me see the light at the very end of a very dark tunnel. And I saw the light. I continued with life. I knew I had lots to live for, specifically my children. I thought to myself, okay, fine, mommy has committed, has made a boo-boo, but then does that mean now my children have to go through life without my love, my care, my guidance, and all of that? And I had to pick myself up, accept my status, learn all that I could, and live my life to the fullest, which is what I'm doing now. I think I've always been jajarach in a way, because I've never really hidden my HIV status. I've spoken about it from day one. The first person I spoke to it about was my then partner, my boyfriend. I told him, he was the first one, and he didn't take the news quite well, and subsequent to that, our relationship ended. And I then spoke to a couple of my friends. I remember this one friend of mine, she's also a nurse, coming from work, bringing this pile of medication. I'm sure she had like 50, different types of vitamins that she brought me. I actually thought that was sweet of her. She thought her friend was dying, and she was supportive. But equally, I've had friends who were malicious in that you'd tell them about your HIV status, and then they'd tell another person and another person and another person. And that's why I always say it is very important for a person to be ready for any reaction and for anything. When you tell one person about your HIV status, be ready for your HIV status to be known about probably 50 more people. And with disclosing to my dad, I actually remember I wrote him a letter, because I had mixed emotions. It was it's a very emotional thing for me, because my sister died from AIDS related illness as well. So I felt, oh, my dad has already been through a lot in terms of this particular thing, and I didn't want to be, to add on. I wanted to tell him because I needed the support, but I thought it was going to be a baggage on him. So, and then I decided to tell him. I wrote him a letter. I went to work, and when I was at work, he read the letter, and he called me, is this true? And I was like, yes. And then, he's been very supportive towards me, though he avoids the topic. I think he feels very uncomfortable. He doesn't like talking about it. But otherwise, he's been very supportive towards me. To be honest, at that point where I used to work, I hadn't disclosed to my colleagues. I hadn't spoken to any of them about my status. My HIV status was disclosed to my colleagues in 2004 by an ex-partner of mine. He went on a rant because we were separating. He did not like it, and therefore he came to my workplace. I was working at a call center. That was when I was a case manager. Came to the call center where I was working and made the announcement. I think he thought that was going to be the end of me, or it was going to embarrass me. But actually, a lot of people that were working in the call center came out to me to say, we are also living with HIV. And it actually made me realize the number of people that were actually living with HIV. And my supervisors, my bosses, everybody was just supportive. It was never an issue, especially at the workplace. However, recently I did have an occurrence that made me realize that there is still a lot of stigma within the profession by healthcare workers that are actually supposed to be in the know when it comes to HIV and AIDS. So I was consulting a patient, and a colleague of mine was in the room. The patient was seeking post-exposure prophylaxis, which is medication that you take when you have had accidental exposure to HIV, be it a condom-based, or you've been in contact with body fluids of another person that you might suspect that they're HIV positive, or with a status that you don't know. Then this guy had a condom based, and when the patient came in to my consultation room, he said that my partner is HIV positive, and I've had a condom based, so I need post-exposure prophylaxis. And of course, as a clinician, I screened, okay, is it within 72 hours? Your baseline HIV rapid test, is it negative? I did all of those things, and I offered the patient post-exposure prophylaxis to go take for 28 days. And then in 28 days, again, I'll be seeing him and probably discussing the possibility of him being on PrEP now, which is pre-exposure prophylaxis, which is now treatment that you will take for as long as you are exposed to prevent you from contracting HIV. So now, after this patient walks out of the room, my colleague now says to me, how umzwile lo muntu uthi kahle kahle ulele nomuntu wangasebenzisi ikhondomu eyazi ukuthi une-HIV. No, usebenzisa ikhondom yabhesta, but mina bengeke nanoma kusetshenziswa ikhondom. And I looked at her, because this is somebody who knows that I'm also HIV positive, and I said, actually, as a clinician, you should be knowing that when you're HIV positive, you are still a normal person who still has normal sex. And furthermore, there is PrEP, there is PEP, there is when we are virally suppressed, we can't transmit the HIV to our partners. So if you are saying that you would never ever, or you're expecting HIV positive people to not have sex, like, what are you saying? And it actually made me realize there is still a lot of stigma within health professionals as well. Okay, first things first, when you are virally suppressed, it does not mean that you no longer have HIV. right? It does not mean that you now have to to stop taking your treatment. It basically means that your HIV is undetectable, it's suppressed, and at that point, when it gets to that level, you are no longer infectious. That is when the U is equals to U comes in, which is undetectable is equals to untransmittable. It means at that point, when you've been taking treatment, most probably for a period of 6 months, after you've taken treatment for a period of 6 months, your viral load will become undetectable. And then at that point, you cannot transmit HIV sexually to your partner. Hence, I mean, I can make an example with my relationship. I've been with my partner for the past 5 years. He's HIV negative, and he remains HIV negative while I'm HIV positive on treatment and suppressed. And if we do want to have a baby, we can have a baby. If we do want to have condomless sex, we can have condomless sex without me actually infecting him or posing any danger to him. Look, it comes naturally. HIV has now become a part of me. So, me talking to people on social media about it, me doing my talks, it's like second nature. It's natural. Even with my patients, if I see that if a patient comes into my consultation room and I see this patient is struggling and this patient thinks HIV like is the worst thing to ever happen and HIV is career limiting, HIV is life limiting or whatever, then I actually talk about my personal status to make them, to calm them down. Though some of them will say they don't believe that I'm HIV positive because of how I look, because unfortunately still at this point we still have those perceptions of how an HIV positive person should look. They should look a certain way, they should be a certain weight. So if you see a big woman like myself saying she's HIV positive, some people find it very hard to believe. But back to the question, I do actually talk to my patients about my status, to calm them down, to show them that there's hope, to show them that life can actually go on with an HIV diagnosis. Okay. My advice to a newly diagnosed person would be that they need to, number one, take it easy, be easy on themselves. They mustn't be too hard on themselves. They mustn't rush into disclosing. They must, take things as they come. But in all of that, in them seeking help, seeking counseling, and all of that, they need to appreciate how far we have come in terms of HIV management. When HIV was introduced, it was introduced to us as a death sentence. But in 2019, there's absolutely no reason for a person to be sick from HIV or, to be looking, very, very ill because we are better managing it. For example, we are now testing and treating. When we test you today, you are HIV positive, you've got an option to start treatment right then and there. You can be sorting out your psychology and everything else around you whilst you're making sure that health-wise everything is okay, at least physically, physical health.